Hi guys, Dr. David here.
Dr. Ian from Sprouting Health Chiropractic in Rutherford.
Today we'd like to talk about breastfeeding, and breastfeeding could be a very beautiful thing for newborn as well as first time mum and dad and subsequent trials as well. It really helps support the baby's emotional status as well as increase that sort of skin on skin contact between mum and bub. However, when there is a bit of problems, for example latching, when we have a bit of structural restriction in feeding, and that can quickly become very overwhelming for the family, and it can be quite stressful for baby and the mum as well, especially when we see symptoms like baby not putting weight on, and a baby fevering one side, turning the head only on one side compared to more than the other side. When we see some sort of nipple blistering, bleeding, painful feeding, when we see shallow latching, we can also expect some sort of clicking noises coming from baby when they feed, and a lot of gas going into baby's stomach as well. So what can cause these type of things to happen? Quite simply, it could be anything to do with baby's development in mum's womb. So it could be just a physical restriction like a tongue tie. It could be a shallow latch. It could be a restriction around the neck, around the cranial bones as well. That could be coming from for no reason. We just don't know. It's just how, for example, the baby positioned in the womb. It could be related to the trauma when baby were being delivered as well. So these are the things that we can look into. Now, Dr. Ian's going to talk about some symptoms that mum can experience with this type of issues.
Yeah, well, so as much as the restrictions that the baby is experiencing because of the birth process in itself, that affects the latching and everything, as Dr. David said, another factor is within the mum herself as well. So, for example, is again structural musculoskeletal things such as back pain, neck pain, loss of strength and function overall can definitely then affect how the mum would be able to lift or carry or position their child, and so therefore she might just be favoring one side or the other, and that's definitely a factor as well. So obviously chiropractic care, we can help with all those things by regulating the nervous system, removing the restrictions within the baby and also within the mum, so that the mum can position herself better so that she can have strength and overall function to be able to lift the baby, to position the baby better and to maneuver in different ways, and also for the baby too, just so that with the better regulated nervous system they can latch better, they can move better, and hopefully then and also just ease and making the body be more at ease so they can digest better as well. So with chiropractic and assisting with breastfeeding, obviously it's not just we're not the only solution. It is recommended that you also reach out to some kind of lactation specialist, for example, and also other pediatric specialists of different types that can help your journey in all these things. But definitely with chiropractic, as we regulate the nervous system, we tend to see that everything will function better because the body will be able just to have better connection between the brain and the body overall. So that's how we chiropractic can assist in breastfeeding and a lot of other things as well.
So what we just said, it's based on a limited amount of research in chiropractic, and a lot of them are case studies and case report type. So they are lower in evidence. We need a lot more cases to really tell people that, hey, this is the go-to. But what we can see through this case report is that about in most cases the problems that they go initially that they have to completion of their treatment plan, a lot of the issues actually is and improved by 70 to 100%. So if you are struggling or your baby is struggling with some sort of issues like colicky babies, upset baby, not sleeping, not regulating properly, then reach out and see whether if one of us can help you out.
See you later.